Okay, welcome back. Let's read. So last time we was reading about the lymphatic drainage association, the organ. The more higher, remember ilia it's associated drained the lungs, and it's associated with lung cancer, granulomatous disease, and sarcoidosis of pulmonary TB. Axillary is important for metastasis, especially the breast cancer. Remember the axillary metastasis, especially breast cancer. Remember Sister Mary Joseph node. Sister Mary Joseph node is associated with the gastric cancer. Another one to remember, just like that one, is the Bishop node, supraclavicular, right hemithorax. So the right one drain the right hemithorax. The left one is the one called Bishop node. That one Bishop node is the one who drain abdomen, left side hemithorax and abdomen and pelvis. Is associated with malignancies in thorax and abdomen and pelvis. So the Bishop node, it will look something like this. Remember the left side. This is the right side. This is left side. Bishop node associated with any cancer on chest or abdomen too. So the Bishop node is localized in the left supraclavicular fossa, which is above of the clavicle on the left side of the neck. It's part of the lymphatic system and drains lymph from the chest, abdomen and left head, neck and lower extremity. The clinical significance is a visual node. It is important clinical finding that his can be indicator of metastasis, abdominal malignancy, and certain infections and neurovascular pathologies. Enlargement of the visual node is called Trousseau's sign. It can be difficult to access in a healthy individuals because it's very deep. Okay, it's look something like this too. So visual node suggests abdominal malignancy, could be stomach or bladder, pancreas, kidneys, testicles, ovaries, lymphoma, and prostate. Remember, usually the left side, left supraclavicular node. This can be the whole area of the visual node, both extremity, inguinal, perineal, genitalia, lower extremity, bilateral, because only the right side is only their superior arm and right hemithorax. So all this is the area of the lymph node, left side. As we can see the graphic here, all the left side and from the diaphragm down is going to the left side here. The right side only take this part. Another one hygeal is para-aortic. Remember, para-aortic is all the pairs of testicles, pairs of ovaries, pairs of kidneys, pairs of fallopian tubes, pair of fundus of the uterus. Metastasis, any of those one. This is good. Those three are very important: external iliac, internal iliac, and superficial inguinal. Remember, external iliac, it drains the body of the uterus, cervical, and superior bladder. Internal iliac is the cervix, proximal the vagina, corpus cavernosus, prostate, inferior bladder, lower rectal, and anal canal. Superficial inguinal drain distal vagina. Remember, the other one is proximal vagina. Internal is proximal vagina. Superficial is distal vagina. Vulva, scrotum. Remember difference from scrotum on testicles. Testicles are drained by para-aortic, and scrotum is drained by superficial. So you have to notice that difference. Okay. Some question that just come to my mind is, they ask you about the testicles. If you have a cancer, if you can make a biopsy, and the answer is no. You can never do a biopsy to the testicles. This is a very common question I have seen in different tests. Never do a biopsy in the testicles, because you're gonna do through the scrotum. You're gonna do a metastasis. So remember, superficial inguinal, every skin below the umbilical, every skin below the umbilical, every skin, the whole skin below the umbilical, all the way down. We're talking about skin, no organs. Skin, superficial inguinal, all the skin below the umbilical, exception the popliteal area and the lateral part of the both feet, and lately the popliteal lateral, dorsolateral foot. So the dorsolateral part of the foot is draining with the popliteal ganglion, and the posterior calf. Okay. Just remember, the right lymphatic duct drain the right side of the body above the diaphragm here. Keep that graphic in mind. Above the diaphragm into the function. So all this drain into the union of the right junction of the right subclavia and the internal jugular vein. So all this drain goes straight into the jugular vein and subclavia, right side. They drain in there. And the other side, the left side, the thoracic duct drain below the diaphragm, everything below the diaphragm, and left thorax and upper limb into the junction of the left subclavia here, the left subclavia, and the internal jugular vein. Rupture of the thoracic duct can cause chilothorax. I showed you before what is a chilothorax. So chilothorax would look like this, some kind of like a milky fluids in the lungs. So if there's like a thoracic duct that come here leaking, the fluid's gonna get into the lungs cavity, and they're gonna give you chilothorax. So it's some kind of like a yellowish fluids like this. This is lympha. Okay, that's the chilothorax. Let's keep going. So in a video before, we talked about here the spleen that is contain a white pulp and a red pulp. The white pulp got all of this. This is where the follicle B cells live. We're talking about the mantle cell. It's important because there's some kind of leukemia that have the same name, mantle cells leukemia. Germinal centers important, and the B cells, remember. Marginal zone is important too, because there's some kind of another kind of leukemia you have to learn. Periarteriolar area here, lymphatic sheath is a lymphatic sheath where the T cells live. Perilymphatic. You can see in a video before we talk about hollow bodies. We talk about target cells, how they looked at in the video before. You can see it. Thrombocytosis. Thrombocytosis happen when we got the spleen out. You got when you have like a splenectomy, you're gonna have thrombocytosis. Splenectomy. You're gonna have thrombocytosis. You're gonna have lymphocytosis. So let's keep going. In the video before, I talk about the thymus. Remember, the thymus is T cells. Thymus, they mature in the thymus. The T cells and the B cells, they mature in the bone marrow. Remember, the thymus is only in kids before 3 years old. We saw that. Remember, thymoma is a neoplasm of thymus associated with myasthenia gravis, superior vena cava syndrome, and pure red cells aplasia, and Goodpasture syndrome. The most important there is myasthenia gravis. They ask this all the time. And remember, superior vena cava syndrome, how did it look like? So you can have multiple causes of superior vena cava, but the patients look like with a puffy face like this. If there's some kind of compression here and this level here on the chest, so the vein coming from the arm or from the head, it's gonna have a lot of ecstasis, a lot of like a resistance to go down, to go into the heart. So you can have this puffy face and swollen, very swollen arm, usually because of cancer. You can see here the same explanation. You're gonna see like a tumor here, preventing from the superior vena cava on a vein coming from the head. It's going to be a lot of ecstasis, and then you can have accessory veins on your skin. You can see here on the skin. That's superior vena cava syndrome. So in this case, the T-MOMA can produce this syndrome. They can produce the pressure, but there's another multiple causes of superior vena cava. So let's keep going. So we're gonna read now about. So in the next one, we're gonna talk about inactive immunity and active immunity. Thank you.